post. I know during my residency, some of my fellow residents brought some gym equipment to one of the resident sleep rooms. I'll have to post a picture from that too. I think I can dig some
gym
up.
equipment. Was this are we talking about a
bench,
leg
some
press,
dumbbells,
an incline bench,
a treadmill, which I did dips
hopefully
on.
it was incline.
The bench did incline.
Excellent.
It did. There was no CrossFit equipment. So for the CrossFitters out there that listen to our podcast, they wouldn't have been able to continue to be fit other than dips and handstand push-ups.
Okay.
Course. Yep.
Yeah. Now, I guess we can hit some statistics here. As far as physicians and nurses, the incidence of overweight and obesity, it was really hard to find a delineation in overweight and obesity in nurses. Figures anywhere from 50 to 55, all the way up to 65% of nurses being overweight. And then 44% of physicians overweight, 6% obese. You thought maybe the obesity figure was a bit low there?
Yeah, the 6% obesity was shockingly low.
So in general, I guess you have your general population, and then you have nurses that are a bit less overweight, and then you have physicians that are slightly less overweight than that. So if you go from like 70% to 60% to about 45% being overweight, or obese, I guess you could call that 50% if you add the two together there, then you start to get slightly less unhealthy. But it is still kind of an alarming statistic. You think that 70% of the population being overweight or obese sounds bad. And then you realize that, over 50% of the people charged with fixing that problem in the medical establishment are struggling with the same issue that they know the solution to. I would argue that most of the population, most nurses, most doctors, it's not for not knowing what they should do. It's just the follow through that is difficult.
Yeah. And easier said than done. As always, people know that I have talked about my various interactions with weight during residency, during lots of night shifts, unlimited cafeteria food. Even though I naturally eat very low carb, it was still pretty easy for me to pack on some extra body fat. And my journey using lifestyle intervention to help recover from that. But all that aside, the 6% obese prevalence in physicians was a little surprising. I'd like to see the number of both overweight and obese physicians in medical school, residency, the first half of their practice, the last years of their practice, and after they retire as well. Because you'd think with this knowledge in extenuating circumstances and long shifts, perhaps at the end of medical school or during residency, that you would see a spike in obesity and being overweight, as I'm sure if we did that study, I'm sure you would see that. It would be very easy to do that because in general, your lifestyle is the worst. You're exercising the least, you're eating the worst, you're sleeping not very well, your social connection might be very strained. And then over the career, you would expect to see that go down, but I'm sure that's not what happens.
Because it's nearly a decade of medical education, you should have all the knowledge and tools to sort of dig yourself out of that situation. Yeah. And even in normal university college students, you see they call it the freshman 15. It might be the freshman 20 now. I don't know what the figures are. It was the freshman 15 back when I was entering college. And I imagine that would be even more exaggerated if you have a more strenuous program, one that's more time intensive, one that, like a residency, which is extremely time intensive. And I think a lot of these individuals actually could and should go check out our friend, Dr. Taylor Martin on Instagram, who did a post on how to get in some resistance training using common equipment found in hospitals. I think there was a walker featured there for some dips, something like that.
Yeah.
It was a very cool post and something that I didn't think of at all when I was working in the hospital for, many years in the past. But there was equipment all around me that I could have made use of.
Yeah, very underrated post. I know during my residency, some of my fellow residents brought some gym equipment to one of the resident sleep rooms. I'll have to post a picture from that too. I think I can dig some
gym
up.
equipment. Was this are we talking about a
bench,
leg
some
press,
dumbbells,
an incline bench?
A treadmill, which I did dips
Hopefully
on.
it was incline.
The bench did incline.
Excellent.
It did. There was no CrossFit equipment. So for the CrossFitters out there that listen to our podcast, they wouldn't have been able to continue to be fit other than dips and handstand push-ups.
Okay.
Yep.
Yeah. Don't need a lot of equipment to do those. But I guess we dive into some of the data now. So we found 2 conflicting studies on and this is actually the contrary to the bulk of the data. The bulk of the data is looking at how do physicians or nurse practitioners perceive their patients by BMI, weight stigma, and, you can't blame every medical problem that a patient has on weight, even if it's easy to do, because that's going to lead to misdiagnoses, and that's a bad outcome for the patient. That's where the bulk of the research is focused. But we found 2 studies which are on opposing sides. And one of these studies found that patients were allegedly more likely to trust weight loss advice from an overweight physician. And the other study found just the opposite. So we couldn't find a supplementary data file for the first study, but they had participants basically look at a obesity pictogram and classify their physicians on that pictogram. So we don't know what this looked like, but it sounds like a foolproof research method to me. Let's take a look at a pictogram. And this specifically, I don't think included weights. So, this basically just tells you BMI and shows a picture of what this individual might look like.
Yep. And there was 5 categories in the study, I believe. Perhaps these were the exact images or pictograms they used. But I can't hardly even imagine telling a patient, go to your doctor, but keep in mind, you're going to have to rate him or her according to this pictogram scale afterward.
Yeah. Imagine if your doctor saw you holding up this pictogram, looking at the pictogram. Maybe you draw a little stethoscope on the one that you think looks like them.
Yeah.
Just so you can tell, because none of these have stethoscopes. So it'd be kind of hard to tell what your doctor looks like.
I guess so. Where would you be, or where would I be on the pictogram?
If I would be a separate figure off to the right, one that has the waist that's a little bit similar to the green, the normal BMI, but with shoulders that are similar to the overweight BMI.
So if somebody did look like that, then the patient, depending on what they looked like, could put them in either category.
Yeah. Well, I mean, do you see your doctor's shoulders, or do you see their waist?
Usually both. I guess that might be a trick question, but I guess the point that we're trying to make here, or the point that we're implying, is that if there is a physician that is a gym rat that might be a little bit heavier, then the patient very well might be putting them in one of the pictograms that's further to the right. And that would certainly confound the results, because the idea behind this is if the physician is of a high body fat percentage, that's what it's trying to get at.
Yeah, and body fat is a more sensitive metric than the BMI. And actually, yourself and myself today, we actually punched in our BMIs and we came up identical, at least identical in the sense of after a heavy set of squats, our height and weight came out to a 27.4 BMI. Mm-hmm. So we are considered overweight, an overweight physician and an overweight nurse practitioner. And if you're in study number 1, you trust us less. No, if you're in study number 1, you trust us more. In study number 2, you trust us less.
So there was 2 studies and they had polar opposite results. How could that happen?
You just go to iamright.com and find a study that supports your claim.
Yeah, that's what most internet arguments are. And you don't even need to post the link to the study. You just post the PMID. As long as there's those PMID numbers, then it's just like a check mark.
Ooh, that makes it more work for people to fact check you, because then they can't just click the hyperlink.
Yeah, I guess on Instagram, then that's useful. But yeah, our point here is that if you have to dig into the study design. You can't just post the study, and if you pull up a PubMed or a Google Scholar article, you read the conclusion and it's boosh, take that. That's not really the point.
Yeah, the more literature that I've dug through, the less time I spend reading the conclusion and the more time I'm looking at the materials and methods and results.
Yeah.
So the boring stuff.
Yeah. In fact, finding this pictogram info, we were joking with each other. Well, what did this first study do? Did they have the patient rank how fat the doctor is based on a caricature? And they literally did.
Yeah. Reality is funny sometimes.